Hi, my name is Farishek. I am working for Varshan IT. Today I am going to discuss about medical coding. Here I will discuss introduction about medical coding, what are the branches in medical coding. Now I will discuss everything now. First of all, it includes basics, RCM cycle, eligibility, requirement, certifications, departments, syllabus, and what is the growth of medical coding and frequently asking questions. Today we will discuss all these topics. First of all, basics. Here, regarding medical coding is a process of transforming patients' healthcare information into alphanumerical or numerical form of codes, which will be used for billing, maintaining healthcare information, and research. Here, there are some different departments present in medical coding, which are HCC, IPDRG, E&M, denials, home healthcare, surgery, etc. See, here what we will do, for diseases, we will use ICD-10-CM. For surgical codes, we will use CPT. If it is inpatient, we will use PCS, that is Procedural Coding System. And the next topic is Revenue Cycle Management. What is RCM? Revenue Cycle Management starts from the patient scheduling registration to until unless the patient get the payment. So here we are at the fifth position in medical coding. Here you can see what we will do, right? We will get the patient healthcare information. We have to review and assess and analyze what are the codes we need to code, and we have to follow the chapter specific guidelines to code it. Next, eligibility. Who are eligible for medical coding? Nowadays, there is a huge demand for medical coding. So, here, all size background students, B Pharma, M Pharma, paramedics, physiotherapy, biotech, and all these students are eligible for medical coding. There is no age limitation for certification. Who have graduation, they can do the certification. Certifications are like CPC, COC, CIC, CRC. We will discuss about this in another session. From CPC, we will get certification from HIMA, AHIMA. It's like American Health Information Management Association. This is a most recommended certification. There is no, again, I'm iterating that there is no age limit. It is an open book examination. Total 4 hours examination will be there. In that, pass percentage will be 70. For 100 questions, you have to get 70 marks. Next, what are the requirements to become a medical coder? See, these are the list of things to fulfill to become a medical coder. First of all, written and verbal skills to understand the documentation. Because see, we are dealing with US based data, healthcare information. So to understand that, we have to know the basic English skills. Like why we have to written skills required? Because we have to send the queries to the provider if we got any doubts. And verbal skill, if you want to speak with our clients, we need verbal skills. And next one, medical terminology and medical abbreviations, diseases, pharmacology, and analytical skills. These are required for a medical coder. Then we have to learn ICD-10-CM, International Classification of Diseases, Clinical Modification, 10th Revision. Then CPT, Current Procedural Terminology. Then HCPCS. This is called Hospital Care Common Care Procedural Coding System. So we have to learn the guidelines for ICD, CPT, and meanwhile we have to get up to date with the AHA and AMA coding field guidelines. What are the syllabus for medical coding? Here we have to learn anatomy and physiology. It is a basic thing because we are dealing with human body and structure and its function. Next one, medical terminology. It includes all the terms which will be used by the physician. Example like gastroenterologist, one who specializes in stomach and intestines. Like pharmacology, study about drugs. So these are one of the examples of medical terminology. Then ICD-10 conventions and chapter specific guidelines. In that, we will discuss about what is the code structure, like minimum 3 and maximum 7 characters, alphanumerical numbers. Meanwhile, we have to discuss about exclude 1, exclude 2, includes, code also, code first, C also. We will discuss in these ICD conventions. These ICD conventions will give you a certain guideline how to use the ICD-10 book. Next of all, diseases, clinical indicators, and treatment options. So we have to know what are the common diseases present, what are the clinical indicators, what are the signs and symptoms, what are the treatment options. So once we got thorough with this one, it will be easy for us to look for the support for the documentation. Next one, pharmacology. The learning of pharmacology includes study about drugs, where we will discuss about which type of medications will be used for treating of certain diseases. So once we got any problem list or medication past medical history, we have to look for the support, so that by looking at the medications we will get the support. So we have a meet. I will discuss about meat in other sessions. Next, pathology and diagnostic studies like laboratory tests, diagnostic studies like X-rays, CT scans, MRI, PET scan. If you got the idea about it, we can code the documentation. Next one, CPT and HCPCS. This is regarding surgeries, procedures. So which type of procedure, what code we need to go, like all 5 numerical numbers. We have so many sections in that one, we will discuss in next sessions. Next, medical coding scenarios on logical thinking. See, I'm not telling that it's a bed of roses doing medical coding. Every time we will get so many. Next one, surgical procedure explanation, medical record review, explanation, audit reviews, AHA and AMA coding clinic guidelines, certification training, and job assistance. Here, syllabus for version IT. There is a huge difference between the syllabus for other institutes and version IT. We completely focused on job-oriented training. In that, 1 hour theory and 1.5 hour for practicals. Here we will do chat practice, mock interviews, group discussion. We will provide special material and certification training program. Growth. There is a huge scope for the growth in medical coding with compared to other industries. A lot of MNCs are hiring both certified freshers and non-certified freshers. Our job-oriented medical coding program will meet the expectations of industry and fulfill your dream to become a medical coder. Companies are hiring for both certified and non-certified, experienced and freshers. Some of the companies like Optum, R1RCM, AGS, Coro Health, Gibbs, Claris, RCM. Departments. See, here departments are based upon the company's hiring. We don't have any other option for this one. So there are a lot of departments present, one of the examples like IPDRG, HCC, EED, E&M, HSC, denials, surgery. Now comes to frequently asking questions. Okay, we also discussed about who are eligible for medical coding. Now some of the frequently asking questions here. First question is qualification to become a medical coder. Answer is any science background like BSc, biotech, pharma, nursing, BPT, doctors and paramedics. Next question is, do we really require certification to become a medical coder? Yes, for some companies. But for some companies, they are only opting non-certified freshers so that they can work under a company with agreement. What are the different types of certifications present? The answer is CPC, CIC, COC, CCS, CRC, etc. What are the different type of departments present in medical coding? E&M, ED, outpatient, IPDRG, surgery, anesthesia, denials, interventional radiology, HCC, home healthcare, and so many. Next question is, can we get work from home option in medical coding? Yes. It all depending upon the company policies. Next question is, how do medical coding help you to grow you in your career? This is one of the only booming company at present for science background students. Next important question. So many are asking this question, do AI impact medical coding? I will get these questions so many times from so many coders, freshers. The answer is no. Human intervention is necessary. AI will only help you to achieve the quality and quantity of the report, but it is not going to replace human intelligence. These are some of the FAQs. If you have any questions, please reach to us, call us, and mail us. You can also go through our website provided in the link. Thank you so much.